Now that fall is here, parents are bracing themselves for the usual cold, flu, and allergy threats. But with COVID-19 and RSV cases spiking in parts of the country, some are worried about what their sniffles and other symptoms may mean. KQ2's Madeline McLean shares doctors' advice.
We are in peak weed allergen season right now.
KU Health doctors taking time during a news briefing to help us spot the difference between allergies and COVID-19 in adults and kids.
Excuse me. I think because we know that these symptoms occur, whether it's allergies, other viruses, other illnesses, there is a concern that people will be spending a lot of money doing these home tests.
Dr. Marissa Love, an allergist, says if it's fall allergies, most people will experience nose and eye symptoms.
Typical symptoms involve itchy symptoms. So itchy nose, itchy eyes, sneezing. You can have congestion of the nose. You can also have drip at the back of your throat.
But it can still be confusing. Like some experience a loss of taste and smell with allergies.
Kids have been out of school for a long time, so there's a whole petri of viruses going around.
Right.
So it can really mimic many other viruses as well.
She says if you're not sure, go back and look at your exposures.
Were they around someone who potentially was sick? Have other people in the home gotten sick? And now you're thinking this is more of a virus.
Dr. Love says another red flag, it might not be seasonal allergies.
A person who has never had hay fever, runny nose, itchy nose, sneezing, congestion, has never had those seasonal symptoms before, and then all of a sudden they get all of it, pretty significantly, I would be pretty suspicious.
She says if you still don't know and your goal is to keep your child, loved ones, or community safe, here are her top 3 recommendations.
Everyone in the home who is 12 and up should be vaccinated for COVID-19. That's the most important thing.
Number 2.
Everyone who goes to school or goes to a public place should mask indoors.
Number 3, particularly for kids,
washing your hands at school is very important.
Reporting, Madeline McLean, KQ2 News.
Madeline, thank you. If you are experiencing COVID-19 symptoms before any kind of medical appointment, the KU Health doctors recommend asking for a telehealth option to avoid putting together patients at risk of exposure.